Dr. Jen, I don't know why I'm feeling this way. I mean, I've always been able to do so many things, take care of my family and friends, go to work, do my job, go to school, you name it. I've always been so strong. I don't know why I'm feeling this way. Now, those are words, by the way, I have heard over the years, in my, say, 13 or so years of being a physician. I've heard those words over and over and over again when talking to patients about the symptoms of anxiety and depression. So many of my patients have often felt that their feelings of anxiety or depression actually meant that they were weak, that somehow they were no longer strong. And guys, that couldn't be further from the truth. Having anxiety or depression does not mean you're weak. And it doesn't mean that you're not still strong. Guys, I'm Dr. Jen Caudle. I'm a practicing family physician and a non-air health expert. We are talking about the 7 myths of anxiety and depression. The second myth I often hear has to do with what causes anxiety or depression. Many of my patients will say, well, you know what? I just need to stop doing this or start doing this. I need to start living a healthier life. I need to start exercising more, eating this, not eating that. If I just did those things, I would feel better. And you know what? Perhaps you might. But I think that in some ways this minimizes really what anxiety and depression really is all about. Yes, it's important that we lead a healthy life, that we eat healthy, we exercise, we do healthy things for our mind, body, and spirit. But the truth of the matter is, you may not be solely in control or responsible for exactly what's happening inside your mind right now. Remember that anxiety and depression and so many other mental health conditions are a combination of not only what happens in our world, but our genetics and so many other things. And some of those things, remember, we can't control. Now, it's not to say that this is out of control for you, but I just don't want you to minimize it and say, well, if I just start eating more carrots or bananas, I would feel better. Because that may or may not be the case. Myth number 3 is that you'll feel this way forever. I'm smiling because I'm so glad this is a myth. A lot of people think that anxiety and depression means you're not going to feel well for the rest of your life if you've been diagnosed with it or if you have symptoms of it. And let me tell you, that's not the case. So many people do well, live happy, healthy lives, and anxiety and depression does not have to last forever. And especially when people get adequate and appropriate treatment, you know what? Chances of you living a happy and healthy life are even greater. So be hopeful and be optimistic. Well, shoot, I'm just going to come out and say it. There is nothing wrong with you. There is so much stigma about mental illness these days, has been for the longest time, guys, that somehow having depression, anxiety, or other conditions means that you're internally flawed, that you're eternally flawed, that there's something wrong with you. And no, there's nothing wrong with you at all. Anxiety and depression are, in my mind, no different than cholesterol, high cholesterol, and high blood pressure. They are medical conditions just like any other, and they really should be treated that way. So the next time you start thinking that something's wrong with you because you feel that way, please stop right now. Stop thinking that, because nothing is wrong with you. When it comes to talking about treatment for anxiety and depression, I often will bring up medications and other modalities. One of the biggest things my patients are concerned about when I mention medications is they're worried about medications being addictive. The fourth myth is that anxiety and depression medications will make you addicted. Now, please keep in mind that there are many different types of medications for anxiety, depression, and other mental health conditions. The ones that I typically prescribe my patients do not have an addiction potential. Now, this is something you should talk with your doctor about, but understand, not all medications are habit forming. So please don't let this deter you from seeking out medications and help for your anxiety and depression. Make sure you ask your doctor if you have questions about this or you're just wondering, but don't assume that they're addictive or have a habit forming potential. And along those lines, myth number 5 has to do with how long you take medications if your doctor prescribes them. Many people think that they'll have to take anxiety or depression medications forever. Guys, it's not the truth. There are many people who are on medications and then they're able to get off of medications. So please don't assume that you have to be on medications forever if it's something you decide to do. Also, don't assume that your symptoms of anxiety and depression will last forever, because that's not a given either. Dr. Jen, you're telling me to go to counseling, but I don't even understand why. Counseling is not going to give my family enough money so we don't lose our house. It's not going to make my job better. It's not going to bring back my husband. It's not going to, what's counseling going to do? Why should I even go? Plus, I don't even know if I want to talk to anybody anyway. And those are things that I've heard from patients almost verbatim over the years, and I get it. And I often say, you're right. Counseling is not going to give you a money tree so that you can keep your house from going into foreclosure. It's not going to help make your job better or help your husband or anything else like that directly. But what counseling does is it helps us cope better with the situations that we are given. That's right. Cognitive behavioral therapy is, I think, literally a gem because it helps us cope within the confines and the surroundings that we are dealt with. Myth number 6 is that therapy is not important or that it's not helpful. And I do understand that, yes, some people don't want to open up and talk to someone else. But you know what? I implore you to maybe give it a shot. You might be surprised at literally what it can do for you and your life. And myth number 7 is less of a myth, but more of a mindset that I think a lot of people have. You know, a lot of people wait for a long time before they talk to me about their anxiety and depression. And I think it's because they either poo-poo it, they say, oh, it's nothing, it's just me, or I just need to work harder, or, I don't have any problems. Why am I complaining? My life's not as bad as someone else's. I should be satisfied, or whatever the case is. Myth number 7 really has to do with the importance of this. If you are saying or have convinced yourself that it's not important to talk about how you're feeling with your doctor, I can tell you that that's a myth. No, it is important for you to talk to your doctor about how you're feeling, no matter how small or how big how you feel seems to you. It's important. You matter, and this matters. So don't put yourself last when it comes to this, really, or anything else. Please come talk to us. Guys, I am Dr. Jen Caudle. Thank you so much for watching. If you have not liked and followed my page, I invite you to do so. I do daily videos every single day, guys. I will see you soon.